I'm Dr. Richard Fry, consultant integrative child psychiatrist, formerly a GP, and I've been in practice for some 40 years. Today I want to talk to you about PANS-PANDAS. Um, these are autoimmune conditions. Many people know about them now, but for a long time they were either thought not to exist or to be unimportant. We now know that this is not the case. So pediatric autoimmune neurological disorder and neurological syndrome, PANS, and PANDAS, pediatric autoimmune neurological disorder caused by strep, are two conditions that people often talk about. In fact, these conditions are inflammatory conditions that have effects on the brain following infections, and they are not limited to strep. There is a wide range of organisms we now realize are involved in this process. So I saw my first case of this that I became aware of in about 2016-17 when I saw an 11-year-old boy, and he'd suddenly become very, very anxious after a sore throat and had some obsessional features, wasn't eating, was stuck at home, he couldn't be separated from his mother, certainly couldn't go to school. Before that had been completely normal, loved school, couldn't wait to go, and never had any anxiety. And I was vaguely aware of that syndrome back then, but I wasn't terribly knowledgeable about it. So I did some research and found out about it. And I then had to take a decision about what to do. And in the end, he managed to procure some antibiotics and he was miraculously cured. So I was convinced, because there's nothing like clinical experience to put you in the driving seat and to help you understand. And then over the years since then, I've seen a number of cases of this kind of presentation, some of them more obvious, some of them less so. And sometimes you get results that look like this. And this is what is known as a Cunningham panel or autoimmune screen. This is a test that you can get. It's done in one American laboratory. Unfortunately, it's not cheap, but this area here of something called CAM2 kinase is very diagnostic of acute inflammatory processes at work in the brain, which probably work on the basal ganglia, which lead, it is proposed, to this kind of presentation. And this particular patient also had a number of other raised markers, but this is the most important. And then, so in terms of the symptom profile, you get things that are often thought about in this frame. So the obsessional compulsive features are said to be particularly associated with strep, but I think they can occur with lots of things. You get restricted food intake and reduced appetite, marked anxiety, you can get tics, irritability, behavioral problems, and deterioration in school performance, often, interestingly, to do with writing or maths, and motor or sensory abnormalities. So it's a very unpleasant, distressing, difficult condition to treat and to manage. And sometimes antibiotics help and sometimes they don't. And so the other thing worth thinking about is what is actually going on here. And we see results sometimes that look akin to this. So this is a gene map looking at the serotonin pathway. And if you've seen others of my podcasts, you'll know that I talk about this being a very useful diagnostic feature. This flow here to serotonin can be disrupted by being pulled over to the right, making kynureninic acid. And this gene enzyme complex here, IFNG alpha, is upregulated in this example. And so stress in the form of cortisol or inflammation, and we've just been talking about that in the form of PANS-PANDAS, can upregulate you here and rob your serotonin. So therefore you get symptoms of low serotonin, depression, anxiety, and the other features. The OCD is a bit more difficult to explain, but it is definitely a prominent feature in some. And there aren't really many tests that can diagnose it. The one that we can do, which is relatively easy if you can get it, is something called an ASOT, which looks specifically for streptococcal antibodies. And this is one example of a patient who I saw who had the most extraordinarily high streptococcal antibody result, 3,200, upper limit of normal 200. And this is something else that measures the same thing but looks at it longer term, called DNase B, anti-DNase B. And so this can be a useful test, but it's only positive in about a third of the cases. It's not always strep that causes the problem. So just because you're negative for strep doesn't mean you haven't got it. And so it's a mixed blessing, useful when positive, but often not. And so, what do you do about it? Well, as I say, you can treat with antibiotics, and sometimes that helps. But if you're into the chronic phase, then it's much more difficult because there's no active infection, although it's proposed that there may be bugs hiding somewhere in your system and antibiotics may help. But what actually seems to help much more is anti-inflammatory approaches, and that's when it becomes much more difficult to know what to do and how to manage it. I've had a number of cases now of low-level symptoms where I've treated with antibiotics and anti-inflammatories, and in some cases it's been very helpful, and in some it has made no difference at all, and it's been much more recalcitrant and a longer-term piece of work. So I think the important message to take away is that there are reasons for why your child may change overnight virtually, particularly if there's been a triggering infection of some sort. It doesn't just have to be a sore throat or ear problems, although that's the original sort of spectrum that group A strep was thought about in relation to. It can be lots of other things, mycoplasma, Lyme disease, and many others. And there is a way ahead, but it's not easy. More soon.